Did you know that nearly 7 million Americans aged 65 and over are living with Alzheimer's, and most don't even realize it? This silent disease often hides in plain sight, gradually stealing memories and cognitive abilities. But what if your body is trying to warn you? These are subtle, early signs of dementia that many overlook, dismissing them as normal aging. But first, let's address the elephant in the room. Why should we even care about dementia? Why not just chalk it up to getting older and move on? Well, the truth is, dementia is not a normal part of aging. It's a devastating disease that robs people of their independence, their relationships, and ultimately their very sense of self. Imagine forgetting the faces of your loved ones, or being unable to recognize your own home. Imagine struggling to perform simple tasks like getting dressed or brushing your teeth. This is the reality for millions of people living with dementia. And it's not just the individuals themselves who suffer. Dementia takes a heavy toll on families and caregivers as well. The emotional, physical, and financial burdens can be overwhelming. It can strain relationships, disrupt careers, and leave caregivers feeling isolated and exhausted. But the impact of dementia extends beyond individual lives and families. It's a public health crisis that is costing our society billions of dollars each year in healthcare expenses and lost productivity. As our population ages, the number of people affected by dementia is only expected to grow, making it even more urgent to address this issue. So, what can we do? The first step is to raise awareness and understanding of dementia. By recognizing the early signs and seeking timely diagnosis and treatment, we can slow the progression of the disease and improve the quality of life for those affected. We can also support research efforts aimed at finding new treatments and ultimately, a cure for dementia. But perhaps most importantly, we need to change our attitudes towards aging and dementia. We need to stop seeing it as an inevitable part of growing old and start recognizing it as a disease that can be prevented, delayed, and managed. By taking a proactive approach to brain health, we can all reduce our risk of developing dementia and ensure that we age with grace and dignity. So, let's not ignore the warning signs. Let's pay attention to the subtle changes in our bodies and minds and seek help when needed. Let's educate ourselves and others about dementia and advocate for better care and support for those affected. Together, we can make a difference in the fight against this devastating disease. Now let's dive into the first subtle sign that dementia might be creeping into your life. Number 1. Urinary or fecal incontinence. This might seem surprising, but unexpected accidents aren't always just a normal part of aging. As dementia progresses, it can impact the brain signals that tell us when it's time to use the bathroom. This can lead to episodes of incontinence that are not only embarrassing, but can significantly affect a person's quality of life. Have you or someone you know been experiencing more frequent accidents? Do you find it harder to make it to the bathroom on time? While there are other potential causes for incontinence, it's crucial not to dismiss it as just a side effect of aging. In fact, it could be one of the earliest red flags for dementia. Why is this happening? Well, dementia affects the complex communication networks in our brains, including those that control bladder and bowel function. As these connections weaken, the signals get mixed up, leading to those unexpected leaks. But it's not just about the inconvenience. Incontinence can also be a sign of more significant cognitive decline lurking beneath the surface. It's a reminder that dementia isn't just about memory loss. It affects a wide range of bodily functions and cognitive abilities. So, if you're noticing more frequent accidents, don't hesitate to talk to your doctor. Early detection of dementia is key, and understanding this often overlooked symptom could be a crucial step in getting the help and support you need. Next up is a sign that might be even more unexpected. Number 2. Hallucinations. We've all misplaced our keys or glasses at some point, but for someone with dementia, this can become a recurring pattern. You might find the remote control in the refrigerator or a shoe in the oven. These aren't just absent-minded mistakes. They're signs of disorientation and confusion. Have you noticed a loved one struggling to find things they use regularly? Do they seem puzzled by the placement of everyday objects? This could be more than just forgetfulness. It could be a sign of dementia affecting their spatial reasoning and understanding of the world around them. As dementia progresses, It can disrupt the brain's ability to organize and categorize information. This can lead to confusion about where things belong and a tendency to put objects in unusual or illogical places. While it might seem harmless, this behavior can actually be quite dangerous. Imagine a person with dementia putting perishable food in the bathroom or a valuable item in the trash. It's essential to take note of these unusual behaviors and seek professional guidance to ensure their safety and well-being. Number 3, disorientation. Getting lost in familiar places isn't just a sign of being distracted. For someone with dementia, it can be a disorienting and frightening experience. They might struggle to navigate their own neighborhood, forget how to get home, or even become confused about where they are within their own house. Have you noticed a loved one getting lost on familiar routes, even those they've taken countless times? Do they seem uncertain about their surroundings, even in places they know well? This could be a sign that dementia is affecting their spatial awareness and memory. As dementia progresses, it can damage the brain's navigation system, making it difficult to recognize landmarks, follow directions, or even understand maps. This can lead to confusion, anxiety, and even dangerous situations if the person wanders off and gets lost. If you're concerned about someone getting lost, it's important to take action. Talk to their doctor, consider using GPS tracking devices, and make sure they have a safe and familiar environment to navigate. Remember, disorientation isn't just an inconvenience, it's a sign of a deeper issue that needs attention and care. Number 4, repeating the same questions. While occasional forgetfulness is common, repeatedly asking the same questions, even after receiving a clear answer, can be a red flag for dementia. It's not just about not paying attention, it's a sign that the brain is struggling to retain new information. Have you noticed a loved one asking the same question multiple times in a short period, even if you've just answered it? Do they seem frustrated or confused when you remind them of the answer? This could be a sign that their short-term memory is declining, a hallmark of dementia. As dementia progresses, it can damage the brain's ability to form new memories and hold on to information for even short periods. This can lead to repetitive questions as the person struggles to remember what was just said or done. While it might seem like a minor annoyance, this behavior can actually be quite disruptive to conversations and relationships. It's important to be patient and understanding, but it's also crucial to recognize it as a potential sign of dementia and seek professional evaluation. Moving on to the 5th subtle sign, let's talk about something that often gets chalked up to old age. Number 5, loss of sense of time. We all lose track of time occasionally, but for someone with dementia, it becomes a more pervasive issue. They might forget what day it is, miss important appointments, or even struggle with daily routines like mealtimes and bedtime. Have you noticed a loved one becoming increasingly confused about the time, date, or even the season? Do they seem to lose track of important events or forget to show up for appointments? These could be signs that their sense of time is slipping away, a common symptom of dementia. Why is this happening? Well, dementia affects the brain's internal clock, disrupting its ability to track the passage of time. This can lead to confusion, disorientation, and a feeling of being untethered from the present moment. Imagine waking up and not knowing if it's morning or evening, or forgetting whether you've eaten breakfast or not. This loss of temporal awareness can be incredibly unsettling and can make it difficult to participate in daily activities or plan for the future. But it's not just about the inconvenience. Loss of sense of time can also be a sign of more significant cognitive decline. It's a reminder that dementia isn't just about forgetting names or faces. It affects our fundamental understanding of time and our place within it. If you're noticing this sign in yourself or a loved one, don't ignore it. Talk to a doctor to assess the situation and explore potential solutions. There are strategies and tools that can help manage this symptom and maintain a sense of routine and normalcy, even in the face of dementia. And now, the 6th and final sign, one that's often hidden in plain sight. Number 6, difficulty making decisions. We all struggle with decisions sometimes, but for someone with dementia, Even simple choices can become overwhelming. They might have trouble deciding what to wear, what to eat, or even how to spend their day. This isn't just indecisiveness, it's a sign of impaired judgment and cognitive decline. Have you noticed a loved one becoming increasingly hesitant or unsure when faced with even minor decisions? Do they seem to rely on others to make choices for them, even about things they used to handle independently? This could be a sign that their decision-making abilities are being affected by dementia. Why is this happening? Dementia can damage the brain's executive functions, which are responsible for planning, organizing, and decision-making. As these functions decline, it becomes harder to weigh options, assess risks, and make sound choices. This can have serious consequences, especially when it comes to important decisions like managing finances, taking medications, or even driving. If you're concerned about someone's decision-making abilities, it's crucial to have a conversation with them and their doctor. There may be ways to support their decision-making process and ensure their safety and well-being. Remember, these 6 subtle signs are just the tip of the iceberg. Dementia can manifest in many different ways, and it's essential to be aware of the subtle clues your body might be giving you. Early detection is key in managing this complex disease. If you've noticed any of these signs in yourself or a loved one, don't hesitate to seek professional help. With early intervention, you can slow the progression of dementia, manage symptoms, and maintain a good quality of life for as long as possible. And remember, you're not alone. Millions of people are living with dementia, and there are resources and support available to help you navigate this challenging journey. Don't be afraid to reach out and seek the help you need. Your brain health is worth it.